fourth case of coronavirus has been confirmed in London, Ontario. Health officials say that she was only carrying low levels of the virus and she recovered quickly. Elsewhere, 3 other patients remain in self-isolation. For a closer look at all of this, we're joined by Dr. Susie Hota. She's a specialist in infectious diseases with the University Health Network here in Toronto. Thanks so much for coming in. We appreciate it. Okay. Because people, I think, are just sort of coming to grips with this, how do quarantines work in Canada?
Right, so quarantine's a public health measure that we use sometimes to try and stop transmissions of infections. And the way we employ it is we get people who've been exposed to an infection that could be passed from person to person to stay at home and try to limit their movement, their exposure to other people. And it's pretty much that. Now that term, quarantine, has been used a lot more loosely as well over time. And we've heard it being used, for example, with what's happening with repatriation of people from areas that are affected with this kind of outbreak, where they're actually segregated from the rest of the population. So it's kind of a range of ways that you can use it, but essentially you're trying to limit their exposure to others.
So we saw the situation with the first case in Toronto confirmed, where he was being treated at Sunnybrook Hospital. As we understand, his spouse was at home in what was described as self-isolation.
Correct. Is
that what you're describing it, a form of quarantine?
In a sense, yes. I mean, it's trying to achieve the same purposes. So really staying at home by themselves as much as possible, not trying to go out in public into large, crowded spaces, things like that, in order to try and stop that, again, exposure of other people to the sick individual.
I remember when people had covered, for example, Ebola in Africa and came back and similar kind of thing. But it's not, as I understand it, not necessarily complete and total isolation. Or is it? Yes,
it depends very much on the situation. Quarantines are used sometimes when people are exposed but not yet sick themselves, and we're monitoring and watching them. And then it's also used when people are actually ill with something that can be transmitted from person to person, but they're recovering at home, and so you really want to limit that exposure. So there's kind of a variation in the degree of movement of people and their ability to see others.
Now, we've seen the United States declare a national emergency over this, and they have said that people who are in Wuhan would be isolated for 2 weeks, and really anyone who's been in China, again, some kind of isolation as well. Is that advisable?
I think everyone's trying to do as much as possible to contain this virus right now. We're seeing the numbers explode quite rapidly in, affected areas within China. And we have an opportunity, we believe, in other areas where limited numbers of cases can be imported to try and contain it. While things like vaccines are being worked on, which will take some time, while other countermeasures like limiting and quarantining populations are being used. It's really just kind of throwing the kitchen sink at the situation to try and do what we can to stop it.
Because Canada is still trying to effort the transportation of as many as maybe 190 plus Canadians who are there in the area. What sort of conditions do you think they should be subjected to when they return to this country?
So I think the Public Health Agency of Canada is still considering the options very carefully. There are pros and cons to every approach. One approach would be allowing people, once they got back to Canada, to go back to their communities and just having a very close monitoring of those individuals, because they will not be ill, and allowed to come back here. And that's very clear. So the screening is very important all along the way. But then on the opposite end of the spectrum, we see what's happening in Australia and to a degree in the US, where this, again, the individuals are being separated from the general population. Which is best? We'll find out. I mean, I think problem with separating people from the population is there's stigma, and there's some negative kind of implications to that, and it can cause a lot of fear. So that's one of the disadvantages.
We have time for just one more quick question. And there are those who have said, flu happens every year, thousands of people get it, some people die. Yeah. But this is different. Could you explain how?
Well, definitely the flu is very important, but this is important too, for a different reason. It's something entirely new. We're still learning about the characteristics of the virus over time. And even if it ends up being that it's relatively mild for most people who are infected, this is going to place a lot of impact and burden on our healthcare systems potentially. So we have to be aware and prepared for that as well.
Okay, doctor, thank you so much. Really appreciate you coming in.
You're welcome.